Hi, I'm Dr. Kovar. I am the Medical Director for the Harris County ESD11 EMS service. I'm an emergency physician. I've been practicing here in Houston for almost 35 years. I've worked with most of the hospital emergency department systems and several ground and air medical ambulance companies. My background, again, is in emergency medicine and critical care. The philosophy has been to bring that care to the public in the pre-hospital setting. What we want to do with this series is to reach out to the public and try to answer some of the questions they may have regarding different healthcare events and concerns. This week we have a question from the Lakewood Methodist Church Men's Group. And that question is, hey Dr. K, what are the signs and symptoms I should be worried about that I might be having a stroke? Stroke, by definition, is an abrupt change in neurologic function. Those functions could be changes in alertness, sensation, or movement abilities. Changes in brain processes such as awareness or communication ability, vision or speech, numbness, balance problems, or in movement from mild weakness to profound paralysis are possible signs of an acute stroke. So the causes of stroke range from blocked arteries due to diseases or clot formation or even potential rupture of the blood supply to the brain. Those acute neurologic findings, result from whatever portion of the brain is involved. Certain types of strokes are painless and really unrecognizable to the person having the stroke, and only others around you are going to notice any of those changes. The question is, what does a stroke feel like? There are two types of strokes. There are strokes secondary to ruptures of blood vessels, which are usually abrupt, painful, associated with headache, nausea, vomiting, and change in your alertness. The second type of stroke is relatively subtle. Although it's an abrupt change, you may notice difficulty in your vision, possibly blurring, or just not as clear as it's supposed to be. Maybe one eye or the other. You may notice a difference in your balance, your ability to reach out the way you want, to hold things, to coordinate your movement. You may notice some numbness or tingling. You may notice some weakness. You may notice some difficulty in finding your words, saying your words, or pronouncing them appropriately. So unfortunately, there are a lot of conditions out there that can mimic the stroke symptoms. Low blood sugars, elevated blood pressures, allergies, anything else that may be just affecting your overall sensations, sensorium, what you've been doing. So when there's an acute change in brain function, sometimes it's difficult to tell exactly what you're feeling and what your sensations are. It's really important to, speak out to those around you and call someone to try to help you figure out the exact process. Certain types of strokes affect your ability to recognize that there's anything wrong at all. So involving others around you and activating the 911 system to have the medics come out and do an evaluation is really important. There are a lot of contributing factors to strokes, elevated blood pressure, fluctuations in blood sugar, problems with diabetes, heart irregularities. All of those can be associated with stroke symptoms. If you're with someone who begins to have some abnormal symptoms, possibly onset of a stroke, what are you going to be seeing? Well, one of the first parts is you may notice just a difference in their appearance. You don't see that their face is moving the way it should, left versus right. You may notice a little bit of drooping in their smile. You may notice that their words are not quite correct. You may notice some frustrations in their ability to attempt to communicate to you. You may notice some weakness or some balance problems. Prior to 1990, only about 30 years or so ago, stroke was relatively easily diagnosable by physicians, but untreatable. We did not have the ability to make the assessments or medications to try to reverse the causes. What's happened in the last 30 years is the development of specialty centers and treatments to potentially reverse and resolve those symptoms. So the newer medications and the newer therapies that are available have a significant impact. Remember, stroke is a leading cause of death in the United States, but probably the #1 cause for loss of independence and nursing home care. There are a lot of new developing treatments to reverse and resolve, mitigate the problems of stroke, but they're all time dependent. The longer that you wait, the less effective these therapies are. The ability to contact 911 And to have a medic come out and do an assessment and look for other things, look for heart problems, look for blood sugar problems, and get you connected to those stroke specialty treatment centers is imperative. If you are experiencing signs or symptoms of a possible stroke, contact 911. The call taker there is going to ask you a series of questions and try to get a good assessment of exactly what your status is. They're going to remain online with you, and they're going to walk you through it. They're going to let you know that the ambulance has been dispatched, they're on their way, but they're going to stay on the line and talk to you and try to get valuable information. If you're with someone, talking to that person having the symptoms is important. You want to know, are they having pain, discomfort, nausea? The symptoms can change over time, and it may be very different by the time the paramedics or your physicians interact with you. So what should you expect once the EMS crew arrives? Again, they're going to greet you and initially begin to make the evaluation. What they see, what you say, how you move, what you're feeling is going to be very important information for them and to communicate to your stroke care specialist. They're going to evaluate your heart rate, your blood pressure. They're going to look at your heart rhythm. They're going to look at your blood sugar. They're going to look at all of these things that could be adding to your symptoms or mimicking signs of a stroke. We at Harris County ESD 11 are ready to respond and start the evaluations and care required to limit or resolve an acute stroke event and place you in the most capable hands of our hospital partners. So if you or your group have any questions or concerns or have questions to ask, please reach out. Look at the number below. And again, we're here to help. I'm Dr. K.